afternoon, everybody, and welcome to Zahn Academy. I'm Fran Parathyris, and this is A Look in the Lab. And today I have Dan Thornton with me from Nighthawk Dental. Dan is a CDT. He has multiple CDTs and is working towards his MDT, and we're so happy to have him here today with us. Dan and I have come up with some poll questions, and we'd like this to be an interactive webinar. So please, when we put them up, if you wouldn't mind answering. And also, we will have room at the end for some Q&A. So if you have any questions for Dan, please type them in at the bottom of your screen, and we would be happy to answer those questions for you at the end. Dan, thank you so much for joining us today on your inaugural speaking. So happy to have you. How's everything doing over there in Ohio?
It's actually not too bad right now. Everything's just kind of warm and kind of cloudy, but busy.
Awesome. Awesome. That's so great. You want to tell us a little bit about yourself and Nighthawk Dental?
Well, I've been in the business for 23 years. I actually started off in being a crown and bridge waxing technician and worked my way throughout the lab, learning all the other ones, getting into dentures, partials, implants, crowns, zirconium, all that kind of stuff. Then pretty much over the time frame, just kind of jump from department to department to pick up what I can and learn what I can.
Excellent. And what brought you to becoming a laboratory technician? Like, what interested you to become part of this, really beautiful profession? I mean, you guys really change people's lives every day. It's definitely very noble. And what made you further your education to be a CDT and now working towards your MDT?
Well, the funniest thing is I actually was a culinary chef back in the day. I went to culinary school and I was trying to get out of culinary school because of all the late nights, the weekends, the holidays. So I ended up finding this by accident.
Okay.
I actually was working with a temporary service trying to find a job to get out of being a chef and working all the time. So they come over and said, hey, I have a place that's interesting in something, and I did ice carvings and stuff like that. So they're like, hey, I know you can carve. You want to check this out? So I said, sure. Went over, checked it out, did a couple wax ups for it, and ended up being there a long time.
Wow.
Yeah, it got me into
artistic if you can, I mean, chefs are artistic. And then, like you're saying, you're ice carving, and that brought you into carving out wax ups and things of that nature, and teeth and all. So, wow, what a progression, right?
Right.
And you've been there ever since. Well, not been there ever since, but pretty much.
Been in the field. Yeah, I was there 21 years in that company. But then it was like over the time frame, everybody kept saying, get your CDT. And I'm like, sure, why not? So I got my first one. And then after that, I'm like, why don't I go for a second one? And then I'm like, why don't I go for my third one? So ended up that my second and third one, I did them both in the same year. And actually I had 3 CDTs within like 3 years.
Oh, wow.
Amazing. So now just working ahead and trying to get my other 2 so I can be a master tech.
That's wonderful. Good luck on that. I wish you all the best. I know you're going to do it, and you're probably going to do it pretty fast too, since the other 3 were done so fast. And do you encourage laboratory technicians to get out there and further their education and go for the CDT?
Oh yeah, most definitely.
Now,
it's a good actually thing of selling, because I mean, a lot of labs are hunting for CDTs. Because I mean, that shows that you've actually dedicated yourself to the work and also to our field.
Right.
So most definitely.
That's great. And definitely, I mean, you want dedication, right? Moving forward, and everybody should further their education in any field that they're at. I believe strongly in education. That's why I'm in education here. How did Nighthawk come to be?
Well, Nighthawk came to be because the girlfriend and I was sitting around talking, and I was thinking of cool lab names. And we started talking, and she actually made a comment that her mom was a Nighthawk, and it just stuck. So I'm like, oh, I like that. So when I actually started Nighthawk, I started out at night also. So I was working a lot of night times doing designs. So for other labs, doctors, and whoever else needed it. So I was doing that at night. So I'm like, it's kind of perfect fit. Then now it's turned to a daytime.
That's awesome.
Still some nighttime, but
yes, like you were saying, working, evenings and holidays, not much different than being a chef, right? When you have your own laboratory, it's like You just constantly trying to keep up with the demand, right, from your clinical partners.
Most definitely. There's sometimes I'm working anywhere from 5 days to 6 days, sometimes over
Right.
the weekends, depending what I have going on in my schedules or chairside surgeries I go to, or anything else that I might have on the schedule of just making sure I can get cases out the door on a timely fashion at the same time.
Yeah, I mean, I was talking to you not too long ago and you were contemplating on not going on your vacation. I was like, no, Dan, you have to go on your vacation. You need to decompress, right? And come back fresh so that you can, keep on going. And sometimes you need to do that, right? I'm glad you took your vacation. I know it was hard for you to do.
It was, but good news is I actually cleared the lab out to actually get ready for the vacation, and it wasn't too bad when I got back because I pre-planned for everything. So now I'm still working out some of the other cases that came in to get out the door. But yeah, it was a good time. Yeah,
As
definitely wear
far as
sunblock at the beach.
Yeah, definitely, definitely. Um, are you a full service laboratory or are you basically like a crown and bridge? Well, no, I know that you do 3D printing and basically dentures, but are you also full service?
Well, that's the funniest thing is what do you exactly call full service? Because like I offer partials, but I don't make them here. I
Okay.
design them and I have them outsourced to one of the companies in the United States who does laser centering for me. But I
Mhm,
only do a few of those for a few of my customers. But most of the other ones, I'm doing implants, I'm doing crown and bridge,
mhm.
I'm doing hybrid cases, forged designs. So does that include full service? I kind of, there's certain things I don't do like ortho. Uh,
Mhm.
I don't do ESIC retainers or anything else
Right.
like that because I don't have the equipment or
Mhm.
comes the time for it.
Right. Right. Yeah, I would consider you to be pretty much full service with some exceptions, right?
Right.
And your expertise, where do you say that expertise lies mostly?
Um, I'm going to say I spent a lot of time over the years in implants
Mhm,
and actually components and doing bars, hybrids, and stuff like that.
mhm,
So I like to attend a lot of the digital aspects of like the all on X cases
mhm.
and a lot more bigger cases, I would say, because
And
it's just,
I know you're 3D printing, so I
oh
see,
yeah.
I definitely follow you and your cases on social, and I've seen some beautiful, beautiful denture work. Um, what was it about 3D printing that really piqued your interest and said, this is something that I really want to get into?
I've actually wanted to get into 3D printing for a long time over the years because I see it was coming. And that was
Mhm,
even before we started getting all the different printers in. Yeah, first time I've actually came into Lucitone or seen Lucitone was when he was launching it with carbon years
mhm,
ago at one of the Chicago meetings. And I'm like, oh, this is cool.
mhm.
This is going to be big, but you can only use it with carbon.
Right,
Well, not everybody can afford the carbon printers, to be
exactly.
honest. So I'm like, oh, okay, I won't do it then. But normally you kind of start out, you can either start out with smaller with like Form Labs or whatever to get something started. But I think 3D printing is going to be where it's going to go. Because I mean, like, look how we are now. We used to be PFMs. Now we're all zirconium. Pretty soon, I think we're going to actually be all printed, and everything's just going to be streamlined to where everything's going to be printed.
Right, right. I mean, not last year, but the year before, we in Chicago had a, a 3D a printer that would print zirconia. So it was pretty cool to
Right.
introduce that. And I believe you. I believe that things are going. I mean, look, we're seeing now 3D printed, permanent crowns coming into the the picture. So I agree with you. I think that's where it's definitely going for sure. And when you had to make a decision on a printer, I mean, can you walk us through what that decision process looked like for you? Was it, I like this resin, so I know this resin could be printed on X, Y, and Z printer, so that's why I decided? Or is it more along, I like this printer, so now I'm going to look into what resins this printer is compatible with?
A lot of times it depends on how I was looking at what I was planning on doing with it. Like, I'll be honest, one of my workhorses is the Form Labs
Mhm.
because I do all my models on it. But I can set it print, let it print overnight. I don't care. I'm not trying to turn it around in an hour or two.
Right.
Now, when I start getting into more of the higher priced dentures or the all on X cases, I need something a little bit more accurate, a little bit more faster, and then ones that actually have the material that can actually handle that too. That's when I started thinking about the other printers I wanted to add on to it.
Mhm.
Some, as you know, some materials are not offered for certain printers. So you have to either look into that printer or take a different material.
Right, right,
So
exactly.
all that had to come into the thought when I was trying to make the decision to add a printer on, and what am I going to do with that printer? I don't want it to sit here and not do anything because I'm
Exactly.
just wasting money.
Right, right. It has to work for you, right? It has to
Right.
work for you. It has to work for your clinical team. Um, you mentioned Lucitone digital print. So is that your resin of choice for fabricating your digital dentures at this time? And how did you decide I want to go with Lucitone?
Well, that is actually my go-to. That is actually what I call my premium digital denture is the Lucitone.
Mhm.
And the reason I picked it is because, well, like looking at it, playing with it and everything else, it's flexible. It kind of warms up in the mouth, so it has a little bit of ply to it. So you can use it for more than just dentures. So I've been doing it for flippers also.
Okay.
And I got into a lot of that because I'm like, we should be able to print these by now and everything else. So I kind of stay away from just printing it in tooth shade because the tooth shade seems to be harder,
Hmm.
but the pink is a little bit more flexible from what I experienced. So
Hmm.
it gives a little give. So that's one of the reasons I started adding on to it. And matter of fact, when someone approached me on it and on the printer, I was like, oh, I don't know. And then my head just went, why not? Let's do it. So I ordered it and got everything in. And matter of fact, 2 weeks, 3 weeks later, I was launching it and putting it out there that I was doing the premium digital dentures, and everybody started getting interested. And now that's pretty much what I do. And there's
Amazing.
times it's like right now I got about 15 dentures sitting behind me to design. And it's just grown just with the digital dentures. That's
That's
amazing.
amazing. That's amazing because you have the trust in your material, you have the trust in your design, abilities, and and basically what you did was you started marketing it to your dentist. Is that how you started to get the word out there? Hey, this is what I'm doing. And how would you say that that went?
Well, good news is a lot of the dentists I work with, I have a very close relationship with them. So if I walked in with, let's say, a different denture and then with the Lucitone printed denture, and I show them the comparison, yeah, I can actually tell them, it's like, well, Lucitone can be relined, Lucitone can be fixed, it's repairable compared to this other denture that if it breaks, we throw it away, we make you new.
Hmm.
A
Hmm.
lot of them, they're still old school. They want to actually be able to repair it or have an option to repair it if they need to.
Okay.
So that's what brought a lot of the Lucitone into my side, is because it's repairable and it can fix it.
What about the repeatability? I mean, have you brought that up to them that it's on an STL and you could just reprint if you needed to?
They like that also. And the good news is with how it is, after I started getting them into the digital workflow, we actually cut down chair time. So the normal traditional denture, as you know, is normally about 5, 6 appointments before you're finished.
Hmm.
Some of these workflows, I got down to 2 appointments.
I'm going to now launch a poll because I want to see out of all of our attendees out there. Here it comes, everybody. Are you offering 3D printed dentures to your doctors at this time? And if you wouldn't mind answering that poll. And if yes, are you using a Lucitone digital print or something else? So Dan, would you mind pretty much going through maybe the workflow so that, what your workflow looks like from start to finish with Lucitone digital print?
Well, do you want to actually start from like the impressions from the doctor or the scans from the doctor? Where would you
Is
like to
it,
start with that?
is it mostly scanning that you're getting from your clinical team, or are you getting a mixture of like PDS impressions as well?
Believe it or not, it's digital.
It is. Wow. Okay.
I went from actually when I started accepting cases and fabricating cases here, I started doing it out with stone. A few of the doctors was digital. Not a lot of them was into the digital yet. But as I started working throughout the year, they started switching over and becoming digital.
Okay.
Now, with the dentures, I started showing them techniques on how to do it so we can actually hit that appointment by the second time. So that either it could be a try-in or it could be final.
Okay.
And a lot of the doctors now got to the point where they can actually we don't even have to do try-ins. We just instantly go to final on a digital
Wow.
plan.
That's amazing. That's
Especially
amazing.
especially if they have an old denture that they would wash to do a reline,
Mm-hmm.
3D scan it. We make a new denture from that.
Right.
And that
Exactly.
actually takes down the workflow for them and the chair side for them to where now they're doing it in 2 to 3 appointments.
Now, when you look at the ROI, because chair time is money, right? And you'd be able to discuss that with your doctors, as well as the time that it takes you in your laboratory. You see that increase. It's almost a no-brainer, right?
Oh, most definitely. Yeah, and that's what a lot of my doctors wanted. They got tired. They're tired of how long it takes to get a traditional denture,
Mm-hmm.
because they have to go through all the steps, all the try-ins, everything else to get to that final. And then a lot of times they still have to do something else to it compared to after we got them into the digital workflow, and they will fight you. They will fight you because
Mm-hmm.
it's something new for them. And it's just like everybody, it's something new. You have to start getting into it. Then you start realizing that it's simple. It's easy. Keep it simple and stupid. Just kiss. And
Right.
that was the best way to start teaching and showing them how to do it. And now it's constantly flowing. Makes it a
So
lot easier.
I have some results for you, and I'd love for you to be able to comment on them. So there are 27% of our attendees right now are offering 3D printed dentures, and 73% are not. So what kind of advice would you give to the 73% about getting started like you did? I mean, you just basically jumped into it, right? What would you say?
I would say, you know what? Get something out there. Get a flyer out to your doctors that you're doing right now. Why not move into digital world? Let them actually experience the workflow and saving them chair side.
Mm-hmm.
Why not? I mean, what do
Awesome.
you got to lose? I mean, if not, you have to remake a denture or print it a couple times.
Exactly. Great advice. Now, 36% are using LDP and 64% are not. They're using something else. So I just wanted to end that poll with us so we can get back. So
Yeah,
I know
there's
there
going to
are a
be a
lot of
lot of
devices out there,
new
and it's
materials coming
basically
out.
preference, right? It's
Right.
basically preference. But you've had some really good luck with LDP. I know that, it's pretty easy to use. I mean, I basically went to Charlotte and I actually fabric printed and was able to fuse the teeth into the base, and I, finished the product, and I used the Fuse 3, and we did the bake, and it was really easy, and I've never done anything like that before. I'm not a dental technician. I'm a dental hygienist, so I'm pretty good with a handpiece, but I've never fabricated a denture or anything like that before. And it was really simple. I followed the IFUs. I work with Jimmy Stegall, who's a master and really, really a great teacher. And I'm saying to myself, wow, really anybody can actually do that portion of it if you really needed somebody who wasn't a technician. They could actually take and follow direction and be able to put these dentures together. So
Most definitely.
yeah, I mean, that I found to be, pretty amazing, actually. Um, so you presented it basically to your clinical partners through actually going to their offices and basically showing them two different types of dentures.
Well, a lot of times if I was dropping off a case or if I had a chair side nearby, I'd be like, hey, do you mind if I stop in? I'll say hi. I got
Mhm.
something I want to show you. And then I actually pull out the dentures and show them a comparison. Well, here's a cost-effective version of the denture, or here's the Lucitone printed denture. Which one would you prefer? And trying to just pique some interest, just to make sure to see if anybody was interested in it before we went full force into it and launched it. But I kept telling people, and I started sending out emails to the doctors I was working with that I'm launching this product soon. This product is coming. And some of them actually jumped on board before I even had it launched. I didn't
Wow.
even have the printer in the office yet, and I was getting orders. And I had to
Mhm.
call them up. I'm like, I don't have the printer yet. You're going to have to wait. And they're like, we'll wait.
That's awesome. That's
I was
awesome.
like,
That's a
okay.
great approach. That's a great approach, you know, and like you said, if you have relationships with your doctors, I mean, that's really the way to go for sure. Love that idea. I do have a question. So I figured I would just pop it up and see if it was relatable to what we were talking about, and it is. And John wants to know, what about non-removable labs? Where do we go to learn about dentures? Um, you know, if you wouldn't mind if I answered just part of this, Dan, I mean, we at Zahn now are coming across the country, and we are, you know, we have these road shows, and it's basically about 3D printing removables, and basically removable dentures. And it's all from design through fabrication with, you know, different types of resins that you can learn about. It's a great day of learning. It's about 6 hours of learning, along with breakfast and lunch included. And it's really a great time. And like I said, you learn a tremendous amount. You can go to Zahn Academy. You can take a look at where we're going. John, if you know you'd like to give us a call, by send me an email, that would be great, and I'd be able to give you the list as well. But everything's in Zahn Academy, and keep on checking it, because we're going from now to December with a new location every month, and it's a great time, like I said. What would you say, Dan? Like, where did you go to learn about it? Did you depend on your distribution partner to learn about it, or any manufacturers? Did you attend webinars?
Well, mine was a little differently, because I actually started in the crown and bridge, worked into the dentures, so I was setting teeth by hand. Then with the bigger cases, like for the zirconium and all that, I've had both experience on the crown and bridge side and the removable side.
Mhm.
So I combined both of those together. Now, to learn it for the digital workflow, a lot of webinars, a lot of, almost everybody's offering some form of, here's denture training, here's your crown and bridge training, YouTube channel. And a lot of times you're just pulling it in and doing it and going, oh, I don't like this, deleting it and doing it again.
Mhm.
So there's been a lot of, no, I don't like this one. I don't like the setup. I don't like this teeth. I don't like this. I don't like that. Delete, start over, delete,
Yeah.
start over. You spend a lot of hours in design. But after you start getting that rhythm down and knowing it, then it's going to be a lot different. Now, with the Lucitone, it actually gives you a lot of the settings you need in the pamphlet. It's easier to follow. It tells you, you need this, you need this. And you can set up your CAD/CAM system to be that. Because after you get your stuff dialed in of what you want, you can set it. You can have everything preset of, like mine in my 3Shape, I actually have it to where I have Nighthawk gingiva. I push that button, it gives me what I want, and I just have to smooth it up and make it look a little bit better. Because most of it, I took time to set it up before, and time, I mean, months of figuring out what I really want to actually get it set up. But now it's a lot easier when I can just click a button, smooth it up, and make it look really well.
Right. So there's a time of where, you have to put your homework in, and you have to get in there and, like you said, get your settings all in there to what you like, what you prefer. And then it's a no-brainer from there, unless you need to make little tweaks or whatever. But also you get those tooth libraries as well, right? So
Exactly.
that's pretty cool. That's pretty cool. So it's easy, kind of like designing the teeth, depending on, people are so used to, the Lucitone
Well,
teeth.
it makes it easier too, because now I have access to those teeth, not just, this brand. I
Right.
actually have the Lucitone teeth that I can pull in, set a denture up in the first time, and not have to do a tricky, backdoor kind of make the denture work with other teeth.
Mhm.
I actually have those teeth in the library that they're like, you can use them, you can print them from the first setup, and not doing anything,
Mhm.
backdoor wise.
Mhm. Which is great. That's great. So the tooth libraries that come with it are like the Genius and the Portrait, right? And the Economy. That basically.
Yeah, there's like 4 different libraries that I saw,
Mm-hmm.
and I mean, some of them you're gonna scratch your head and go, "What?" But then you're going like, "Okay," because I'm not used to using those teeth. I'm used to using a lot of other teeth when
Mm-hmm.
setting dentures, because whoever you're working for, your resale person is for teeth, you get used to a certain brand.
Right.
So when you start seeing the other brand, you start scratching your head going like, "I don't know if I like this." Then after you start working with it, you're like, "Oh, no, I really like this." this makes my life a lot easier, especially if they have it all set up in a library, but good for you, because then everything just comes in right. And you're like, ooh, I just have to make a couple tweaks and I'm good to go.
Yeah. Did you find that the design process in the beginning was difficult for you, like to grasp when you first started? Because I know a lot of people are on here and they're not offering 3D printed dentures. So
Now,
part of that is getting the design down pat. I mean, do you have like any tips and tricks, or you want to give us a little bit of your background about when you got started so that they don't feel discouraged? You know, because I feel like there's so much discouragement sometimes when you're starting something new, that if you hear from somebody who's successful and had a couple of setbacks, what they were and what the solutions were would be so helpful.
well, I was going to say, not putting out my age out there, but I started before we even had design programs. So then I started when we was actually hand waxing copings to copy mill zirconium before we started getting 3Shape pulled in and thrown on all the other ones to where we can actually design stuff. So it takes some time. Then after you start getting into it, then you're just going to start working with the flow. You'll start being familiar with it, and it'll get a lot easier the more you do.
So is
That's
it a
what I'm
lot of
saying.
trial and error? It's just being patient, you think?
It's not just being patient. You're going to have a couple cases going to crash. You're going to have cases that just, you get to the end and it's going to say something's wrong. And you're going to be like mad, upset. It's going to happen. It happens all the time. We normally just have to start over from scratch, and we learn from that. And we do step 1, step 2, step 3. Don't go back to step 0, because then you're hosed. So we just kind of learn how to actually keep with the workflow, and then everything starts getting smoother the more and more you do it. Just like anything else, practice, practice, practice.
Yeah. And what about like failed prints? I mean, did you start out in the beginning with some failed prints, and like, what did you do to like fix that?
Oh, failed prints are the funnest.
Are they?
Because matter of fact, I just had that just a while ago. My power flicked. It wasn't storming or anything else. It just all of a sudden my power just went down and came right back up, and I lost all 3 prints that I had running at the same time. You cuss a little bit, you throw a little fit, but then you just start it again. But if you're actually having a failed print, then a lot of times you're going to have to look to see what did it. And I've had the experience of something's been in my tray that stopped it from printing right, anywhere from maybe a support wasn't connected correct, and so it didn't print. You kind of learn little tricks and trades. I think, to be honest, with the Lucitone, I cheat a little bit. I put a little extra sprue on it, because with the Asiga, it has where you can put a little bit bigger screw on it. So I use that so it doesn't fail my print, because it really holds on to it.
Okay.
Because my first couple of times printing with it, I had a couple of fails. Yeah, I was on with support going, what's going on? And they're like, oh, this is what's happening. I'm like, oh, okay.
And basically like following those IFUs, right? Just keep on following. Don't stray, right?
Correct.
Stick with those IFUs.
Yeah, once you get it dialed in, stay with it. I mean, you can do a little bit of like, I'm going to try this, I'm going to try that. But if it fails, there's normally a reason. So after you figure out that reason, or you get on tech support and you're like, hey, why do you think this failed? Tech support is always really good, because they'll run it through and be like, well, have you tried this? Let me look at your how you set it up. How do you have it on your build plate? What time of day it was,
Right. And tech support, are you talking through Asiga? Do you lean on Dentsply? Do you lean on your distribution partner? Like, how does that work? Because I know a lot of people want to know, like, where's my support? If I need support, where is it? Like, what did you do?
Myself, I called you guys.
Oh, you did? Okay, so you called our technical support. Okay.
Right. I bought the printer from you guys, and you're like, hey, we're doing training. So I started calling you guys all the time.
Yeah.
You sent me through, log into my computer, see how I was doing it, going, hey, how about putting it here, here, and here? And I'm like, okay, let's try that.
I work with them on a daily basis, tech support, and I have to say they are second to none. And I'm not just saying that because I work for Zahn. I'm saying it because they're good people, and I get nothing but raving, compliments about dealing with them. And, you know, they go to our road shows as well, guys. So you get to meet them and people are like, oh my goodness, you're Matt. Oh my goodness, you're Nate. I spoke to you a million times about X, Y, and Z. So it's nice to see, you know, the face behind the voice. And they're the same people all the time. I've been here for, you know, almost 5 years, and they have been the same people. You know, we don't lose our people, which is wonderful, you know.
Well, you got to call out to my favorite rep too, Tracy.
Yes.
She texted me and said, hey, I didn't hear my name. So I'm throwing in a little key out there to Tracy.
Well, Tracy is also wonderful, and you know, all of our customers know it. So Tracy, shout out to you. Thank you for everything you do for all of us here. You know, you make it a lot of fun and your customers love you, and that's what we care about here. So it's all good. You know, I wanted to talk to you a little bit about speed and accuracy. I mean, we're talking about, you know, material. Now we're talking about the Asiga printer you mentioned that you're using. I mean, how does that, the speed and the accuracy of the Asiga work for you? I mean, you can possibly, from design to print to fabricating and getting that denture out the door, like what does that look like for you?
Well, a lot of times if I'm going from completely from design all the way to print in like one day, it's going to take me probably about 45 minutes to design a denture, if that, depending on if I have to bring it in, what I have to do with the scans, or if I already have things set up, cleaned up, and ready to set up the denture and then get it all the way to print. Now, if I'm just doing one denture, which most of the time I'm not doing just one denture, I normally have that build plate full of dentures, as many as I can get on that plate. A lot of times it's anywhere from 4 to 6, depending on the size.
Okay.
That print will normally take about 4.5 hours, maybe a little bit less.
They can't. They already fall within our phone. Okay. What about the ROI? Like that definitely has to change, right? Because this is pretty fast. You can get these dentures out the door where you used to not be able, you know, it would take you days upon. I mean, how has that affected your business being now, you know, on your own for all these years and now adopting this new workflow? How does that look for you now?
Well, you see my social posts. A lot of times you see I have probably about anywhere from 10 to 20 dentures sitting on the plate ready to go for the next time that it has to go. It normally takes me, if I actually have a full denture day to where I'm doing nothing but denture setups or designs in print, I normally have it in the lab about 3 days from design to finish, just so I have that downtime for the print. Because of course, everybody has their certain shade they want. Some people, they want a different pink. So you can't build that all at one time. And I'll be honest, I'm only running with one printer that does that one so far. But if it keeps growing, there'll probably be another printer added to it. So I can do one for teeth and one for base. Just so it can be actually faster, marinate them all together and get them out the door faster.
Right. Amazing. Amazing. What kind of feedback have you gotten from your clinical team since you've been using the LDP? Like, what about fit? And how about aesthetics? What are the patients saying about their new smile?
Well, funny you say that. I actually had a doctor reach out to me, send me photos. The patient wanted to know what I look like because he loved me, because he loved his teeth.
Oh man, that's amazing.
And I'm just like, oh, okay. I was like, that's kind of cool. But I mean, he hasn't had teeth for a while. And after we got it done, he was just that excited.
I mean,
and
that's
actually a good feeling, yeah.
That's life-changing, you know?
Oh, yeah.
And we do know how important fit is. I mean, patients can get sores. It's very uncomfortable. They can't eat. You know, there's always a lot of adjustments that go in when a new denture is being brought in, and that takes a lot of chair time. So can you tell me a little bit about what the clinical side is saying about the fit of these particular 3D printed dentures?
Most certainly. Most of the dentists and assistants I work with, they are amazed with how the digital dentures are fitting. They're used to the old denture that kind of, it fits okay. But when they actually get one of the digital dentures that's dialed in, they're like, this is ridiculous. Like, just fit the first time.
Amazing. Yeah.
You know, a lot of times it's like, that's why I stopped doing a lot of try-ins unless I really have to, because with the try-ins I block out because I don't want it to fit perfectly, just in case they needed to do a wash or anything underneath of it. And then, and a lot of times they're like, well, this doesn't fit like your printed does.
Mhm.
What's the difference? So that's why I'm like, you know what, let's just go ahead and just eliminate the try-in if we feel comfortable with the bite. And I got them on board and how to do it with all the digital workflow and make sure the bite's spot on, or if not, very close,
Mhm.
that it just kind of flows. So that's why we even eliminated another chair side,
Another.
another chair appointment.
Mhm.
And we've actually got it down to a lot of times it's they see the patient. The next time they see the patient, they deliver the denture and they send the patient home.
That's great. And you know what, the patients love that too, because you know the last place they want to be is sitting in a dental chair. So for
Right.
them, you know, the whole anxiety, if they don't have to go through that one more time, it just makes it that much better. And I'm sure patients are raving about their doctor, which in turn, you know, is a compliment to you as well, because you're there working with them, creating this for them. And it's so nice that this patient actually wanted to see who you were, because
Right.
it makes you feel so good about what you do on a daily basis. If you can make one person in that week feel the way you did, it's worth it, you know?
Oh, I've actually had patients look me up on social media and follow me just
Really?
because they're like, I love my new teeth. Thank you so much. And they're not even in the final yet. That was just the immediate dentures. And then, after the hill, they want to get the final, then they'll probably be like, oh, these are like 100 times better.
Right, right.
So, I mean, the good comfort I find a lot of this is if anything happens to that denture, they can have another denture made without going through the whole process because we have the digital files. We
Right.
can print it again. They can have two dentures, one to wear and one for a backup
Exactly.
if they wanted it.
And I love that idea. You know, I've actually brought that up to my doctors. I'm like, when you're ordering, you should just order two. And the patient would be so happy about that. You know, wear
Right.
one for every day and wear one when you're going out on the weekend. I mean, why not? You know?
One for every day of the week and
Right.
one
You
just
could
for
do that.
good.
You could do that too, which is like, you know, with 3D printing, you can
We'll put a
absolutely
little gold tooth in one or something, little diamond or a star.
listen, tooth jewels. It's a big thing now. I don't know if you know about that, but it's definitely a
Oh, I
big
do. Yeah,
thing.
trust me. I did an old acrylic denture with two front gold teeth just
Yeah.
a month or two ago.
Yeah, now the big rage is, getting little crystals, like little tiny crystals. So I'm sure you're going to be hearing about that too. It's coming. I'm
That'll be
telling you.
fun. I'm curious as to how well it'll stick. I'm willing to try it.
Yeah, I mean, why not, right? So, what pain points should somebody expect when starting in the beginning? Like, what would you say was your major pain point when you got started with 3D printing or when you got started with actually using LDP? And maybe some solutions so that someone would know, hey, he did that and this is what he did, and I'm going to try it and see if it works for me.
Some of the pain points is everybody, like dental technicians, they want to get in there. They think it's going to be right the first time they do something, and then when it fails, we get frustrated
Right.
because it should come out the first time. It takes time. You will have failed prints. You want to have failed prints even after you've been doing it for a month. It's going to happen. You just got to calmly go, okay, let's do it again. And if you do this build the second time, exactly the same, and the second build fails too, there's something wrong with your build compared to, oh, I've had a build fail. I printed it again, the second one came out beautiful. And you're like, okay, a fluke. Okay, maybe. But then you just keep going on. Now, a lot of times you're on a time crunch when you're doing it. So you're starting to freak out because you're like, I gotta get this done. I gotta get this done. A lot of times that's when I actually take a step. I go outside, I relax, I sit down, drink some water, a cup of coffee, whatever, chill out, come back in with a fresh mind and do it again.
Mhm.
And find out to see if maybe it was something I did, maybe there was a piece of material in the printer that I didn't catch. You just start learning to, the instant something happens, you know where to start looking. And most of the time when I normally have a fail, that's normally is something broke off, it's floating in the printer and I didn't see it because
Mhm.
it blends in.
Mhm.
And that's normally when I'm like, okay, I get out the little metal strainer and kind of strain my material and go, oh, I didn't notice that before.
Yeah.
And then everything's fine.
I mean, and Dan, that's the first time I've heard of that. So you're
Yeah.
the first person that actually brought that up. So that's great. Another little tip there, because I wasn't aware that something like that can happen, but I guess it can. So it could be one of the reasons why. What advice would you give somebody thinking about adding this workflow to their lab? I know we talked about it before, but I want to end with something like that. Because again, there are a lot of people out there that are not offering it. And maybe after listening to you, they're going to take the plunge.
Well, my advice is, you know what, you can start out any capacity you want. You can go full speed ahead, send it out to all your clients, or if not, find one client that wants to try it. Work with that client closely. I normally like to work with more than one because just in case one's having an issue, the other one might not be. So a lot of times I'm working with 2 to 3 clients when I'm launching a new product, just so they actually feel, and I can actually get the feedback from multiple different offices of how the things look, how easy the workflow is, so we can actually get to the final product before we do a full launch.
Mhm.
Now with Lucitone, I kind of went full force in and I told everybody about it. Because I'm like, you already saw one of my printed dentures. You've already had my economy denture. I hate saying economy. That now I have that new product. It's going to be my premium digital denture. You want to try it? And everybody was like, yeah, let's try it. So, I mean, it just depends on your workflow and what you want to, how you want to start.
Mhm.
And I know I've had a lot of people call me and going, hey, how do you do this? How do you have your setup? How do you have this? And not everybody's going to be able to copy what I do, and I'm not going to copy everybody else's, but you got to start somewhere. If you got to either go full force, medium, or low. It all depends on you. But you got to get the material in to actually start using it.
There's so much support out there, right? I mean, there really is. I mean, I belong to quite a few groups on Facebook, and I really believe that this industry is really about giving back and educating each other and being a support for one another. I know you've been a support definitely to other people, but have you gotten that support from social? Do you think that it's worth it to join these groups and be very active?
Oh yeah, most definitely. I'm on a bunch of groups on Facebook, going over stuff, watching stuff, seeing everybody's print questions. If you're actually on some of the Facebook, you'll actually see me sometimes jump in and actually make a comment here or there. Most of the time I don't have time because I'm too busy doing dentures. But it comes down to the whole fact is, yes, that's a good place to learn. If you're 3Shape, get on a 3Shape. If you're ExoCAD, get on the ExoCAD. There'll actually be questions out there that you can search through it. They'll have videos. Those people are very helpful on actually doing a lot and teaching a lot and kind of helping you.
Yeah.
Very rarely did I ever find anybody that's going to be rude and be like, well, you know, your work's a piece of blah, blah, blah. But I say do it.
I just find that this, industry of laboratory technicians, like everybody just wants to help everybody else. And it's such a great feeling, especially for people that really aren't offering maybe 3D printed anything right now and really want to take the plunge and just don't know how. I mean, the questions, get on one of these groups and ask a question, right? How do I do this? And you'll probably get, I don't know, Dan, how many answers. I mean, people are just so nice about answering and being a support.
Right.
So,
exactly.
I mean,
And
I love that. I love that, about this industry as well. It's great.
well, and that's the thing is the industry has changed from years ago where nobody wanted to share their trade secrets.
Right.
Because they didn't want your competitors to steal the information that you have. We have changed now. We want to help because we're losing so many labs. So many of us are retiring and nobody else is coming up and stepping up. So why not? Let's help somebody else come up because there's a lot of work out there for us.
Mm-hmm.
Why not share? We can become a major force for the patients, not
Absolutely.
just the dentist, for the patients. I do it for the patients. I don't do it for the dentist. I love seeing the smile on a patient's face when they get their teeth back. Like you said, it's life changing.
It's
I mean,
confidence building, like they can eat again, smile, form words correctly. I mean, it's life changing. I mean, it's just such a
right.
noble profession.
That's one of the reasons why I love going chairside for the all-on X conversions, just because you get to see a transformation that if you stayed in a lab all the time, you don't see. You might hear about it, but in a lab, you're just, okay, here's another denture. Here's another denture. How many times am I going to see this denture? Until you actually start seeing patients, or like maybe you're in a dental office and you're an in-house tech.
Mhm.
You start seeing patients, that changes you to where you're like, oh, what's this going to look like? How do I need to move this tooth a little bit to make it stand out better for this patient? Is that going to make them feel better? And it's always great when they're like, oh, this is so beautiful. And sometimes you make them cry, which makes you feel good and bad at the same time. But
Right. It's
you
happy
know,
tears, definitely happy tears for sure.
right,
I've seen a few of those. It feels so good, you know? There's not many jobs that you can be doing out there that can give you that feeling. It's
most definitely.
it's a great feeling to have. Dan, I thank you so much for all of your advice and your insight and just being the great man that you are for coming and joining me here on A Look in the Lab. And I'm going to open things up for questions. Is that okay?
That sounds great.
I believe we have one. And Gary wants to know, Dan, have you tried milling dentures? And
I
what
have.
is the fit comparison?
I've actually, when I first started, I was offering mill dentures also. I had a company that was in PA that was milling them for me. And with the mill dentures, it takes a certain machine, I found out, to really do a good mill denture. And if they have a really deep flange, the burrs can't get in there and get that deep flange. Sometimes you have problems with the fit because the ridge is too deep. So with printing, that takes out that deep ridge. It doesn't matter if you have a deep ridge because you're doing everything as a build compared to the burrs can't get deep enough to get that whole tissue area.
Mhm.
So, and then of course, there's a lot of different settings for mill dentures compared to printed dentures. It just depends on what you want to do. If you want to offer mill dentures, you just take the time and learn it. It's actually is one of the other ways of doing it. And they have some good materials where they're combined materials where it's teeth and pink. So I would just try it. But don't get frustrated if it doesn't fit the first couple of times and everybody's complaining. Just watch the ridge.